Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 12 video. The topic this week is long-term care, the business angle. This week, our readings and lectures have to do with the business aspects of long-term care, as well as the marketing and competition of long-term care. So as we know, the business of long-term care is mostly a private market. Some facilities are owned by the state, county, or city, and veterans' homes are owned by the federal government. But the major model for long-term care is a for-profit model. One of the questions that you might inevitably come up with this week is, do we really want to make a profit from long-term care? And I think that's a very important question, and it's a question that underlies, whether we want to profit from care across the spectrum anyway. But I don't want you to get mired down in that question because that's not the question we're trying to answer this week. I also want you to think about shifting your thinking. A lot of times throughout the semester, we're using that consumer, patient, or maybe policy advocate lens. We're also using the public health student lens. This week, I want you to put yourself in the position of maybe a nursing home administrator. And think about your lecture, videos, and readings through that lens. In your discussion post this week, you've been asked to be in the role of an administrator. So if you start out the week in that frame of mind, it might be easier by the end of the week to do your discussion post. So I just want to highlight a couple of things from the text. Long-term care is competitive right now. And I think some of the reasons why long-term care is so competitive right now is we're seeing some of these specialty care models popping up. You could do a Google search of your area and you might see that there are some that focus on dementia or Alzheimer's or brain injury. Some focus on mental health. So you have these specialty models that are increasing the competitiveness of long-term care. Another issue that we talked about at length is the increasing population, mostly coming from the baby boomers for the next 30 years. Increased longevity of consumers. So our current population that's accessing long-term care does not leave the long-term care system as quickly as the generation before it. We also have savvy consumers. One of the reasons why long-term care is becoming more competitive is people now know how to shop around. And this was not exactly an option for the last century. Higher demand for long-term, quality long-term care is increasing, and we've seen that the last couple weeks in this course. The fact that consumers now have certain expectations about how much quality they will get in their experience. And I think one of the things to think about for long-term care consumers of tomorrow is innovative thinking and technology. The post-World War II generation probably does not mind that much if they move into a nursing home and there isn't Wi-Fi. But definitely the baby boomer population will have certain expectations about the technology that will be in their long-term care facilities. So one thing to think about as you're reading the chapter about marketing long-term care is, how do you sell a nursing home? We did some investigating of how to find a nursing home and an assisted living earlier in the semester. But now the question is, if you were doing the advertising yourself, how would you do it? I mean, do you think that long-term care consumers usually shop around? Do people actually say, if I'm going to go to a nursing home, this is the one I want to go to? Another question is it actually the consumer that does the shopping around? Or is most of the time, by the time you need a long-term care facility, that choice is being made by family members, friends, or other decision makers? Another question is there even a choice? Oftentimes, if you broke a hip, and went to the hospital, you might not have a wealth of choices to go to. It might just be where a bed is available. So, in terms of marketing or selling the nursing home, it doesn't operate like a normal for profit business. Also, something to think about is, what exactly are you selling? Historically, nursing homes and assisted living and home care were not really advertised, and it was considered poor taste to advertise because what you were selling really was considered end of life death, or end of life care, which was considered mostly unseemly to have in advertisements. That's not really the case anymore. Another issue is, are you selling a set price for things? We know that long term care can be different prices for different folks. Is that fair, and is that something you would want to advertise? Do you want to serve everyone? I mean, you have to avoid discrimination in offering your services for long term care, but a lot of facilities or long term care are trying to fine tune their population. Sometimes it's just easier for businesses not to accept medically complex patients because they take up more time and they're more expensive. Is that discrimination? And is that a way that you would want to run a business? Now, if you put on your business hat and you see it through administrator's eyes, if you take all the most complex patients, are you really making it so that you're not going to make a profit? So there are some complex questions that happen in the marketing and competition of long-term care. I think one of the issues for the next generation is looking at how social media will affect long-term care. We're already kind of seeing it. The world is changing around this. Seeing in the inside of a nursing home was not something that used to happen. There was not Facebook pages or Twitter or YouTube videos about what went on in long-term care. These were mostly local establishments that served the local community. So as technology changes, we're also looking at this business model through a much more competitive lens than we used to. So the book talks a lot about competition. Well, I think it doesn't really highlight well that competition through social media is really going to change how nursing homes and assisted living compete in the near future. So both chapters this week are a little bit longer, keeping the video short. As always, I'm here for your questions.